Good evening, everyone. Today I'll be taking genetics and especially the single gene disorder. And to understand the pedigree of such single gene disorders, you must know the various symbols which are used. So, if you see a blank square or an empty square, it suggests that it is representing a male which is unaffected, right? So, unaffected in the sense he is not showing the disease. Clear? Then, if you see a, a blank circle, that represents an unaffected female. Clear? Then, if you see a line between a male and a female, that means they are married. So, the line between a male and a female shows that they are married. If you see two lines between a male and a female, this suggests consanguineous marriage, means marriage between relatives. So that is consanguineous marriage. Then they will be having childrens, and the childrens are represented in Arabic number going from left to right. So the Arabic numbers 1, 2, 3 and so on, they represents the birth order, right? So 1, 2, 3, that is the birth order in a particular generation. Now on the left side you can also see some Roman numerals which are written in a upside down manner, and this represents the generations. Okay, so these Roman numerals represent generations, means this is male, female of first generation, then this is male, female, male of second generation. Clear? So this represents generations. Then if you see the square or circle in black in color, it means they are affected, means they are showing the disease. Clear? So these are important symbols which one should know to understand the pedigree of a given single gene disorder, right? So male, female, marriage, consanguineous marriage, then affected, and finally generations and birth order in a particular generation. Clear? Now the very first entity we will discuss is autosomal dominant. Now before that, you should know some more words. What is autosomes? What are sex chromosomes? What is homozygous and what is heterozygous? Clear? So there are certain terms which you should know because these will be repeated again and again. So if you don't know the words proper, it becomes very difficult to understand what actually we are talking about. Now we know that there are 23 pairs of chromosome. Clear? So there are 23 pairs. Out of these, 22 pairs are autosomes, and the last 23rd pair is the sex chromosome, right? So 22 pairs autosomes, 23rd sex chromosome. Now homozygous means when both the alleles are, or both the genes are same. Like if you write like this, so both the alleles are same. And heterozygous means both the alleles are not same. So heterozygous, homozygous. As we will go forward in discussion, we will understand these terms in a more better way. So starting with the word autosomal dominant, and okay, we can also take the dominant word and recessive word. Clear? Now dominant means even if there is heterozygous presentation, it will affect. Clear? So if it is homozygous or heterozygous, the condition will be manifested. The person will be affected and will show the disease. But in recessive, a heterozygous will become a carrier, and only the homozygous will be affected. So for recessive conditions, both the genes have to be abnormal or both the genes have to be mutated. Then only the person will be affected. If only one of the gene is mutated, the person will become a carrier in heterozygous state, right? So this is just a basic introduction, and I think with the subsequent discussion the things will be much more clearer. Now starting with autosomal dominant. So I think the word autosomal is clear. Now dominant means out of the two genes, at least one should be abnormal, right? Should be abnormal, or you can say mutated. Even if one of the gene is abnormal, person will manifest or person will show the disease or person will be affected. Clear? So if anyone, it means heterozygous, right? So one is heterozygous. Now, so what we say here, at least one mutant gene is needed to express the disease. So out of the two, at least one should be mutated or should be abnormal, and the patient will show the disease. Clear? Shanawaz bhai, good evening. Nice to see you. Right? And you have entered the field at the right time. So we have just started. So in autosomal dominant, at least one of the two genes should be abnormal, and that is sufficient enough for the disease to be expressed or to be shown or to be to manifest, right? So what we say here, heterozygotes, they will manifest the disease, they will show the disease, they will express the disease, right? So heterozygous, you can see here, one is abnormal, one is normal. Okay, now we go to the some statements like offspring means children's of one affected parent may have how much chances of affection of in the offsprings. Like if one parent is affected, how much offsprings will be affected. So for this you can take this Mendelian chart. So this is for autosomal dominant, and here the father, you can say, although it doesn't make any difference it is a father or a mother. So we can see the father is having one mutated gene, right? Mother is having both the normal genes, and father is having one abnormal, one normal. Okay, now when we will get the cross products, again we can see that if this, obviously this abnormal gene will be given to children's, and it will be something like this. Got it? So what we are seeing here, if there is a single affected parent, the other is normal. So if there is a single affected parent, the offsprings, we will see that 50% will be affected and 50% will be normal. Clear? So particularly in heterozygous state, we call it heterozygous because only one is abnormal. One of the gene is abnormal, another is normal. So what final outcome is that 50% of children will be affected, 50% will be normal, because in dominant, only one of the affected gene is sufficient to express the disease, right? So this is a classical scenario. If one parent is affected, 50% of the children will be affected, 50% will be normal, right? So if this is the case here, if one parent is affected, then 50% chances of disease transmission to the offsprings. So offsprings of one affected parent have 50% chances of being affected, because if you see here, if there are 4 kids, out of them 2 will be normal, 2 will be abnormal, or 2 will be expressing the disease. So it is 50% of chance of getting the disease, right? So this is very important to remember here. 50% chance of getting the disease, and in fact 50% of the kids will have the disease also. And this in terms of, because if you see here, this is these are the affected ones and these are the normal ones. Clear? So this is a typical presentation in a case of autosomal dominant. And one important word what we have noticed here, that even a single affected parent will transmit the disease to nearly 50% offsprings. Clear? This is very important. One of the parent is affected, the disease will pass on to the offsprings. Now the pedigree is very easy to identify. If you have a question in related to pedigree of autosomal dominant, simply you need to do one thing: go to the generations first, generation 1, generation 2, generation 3, and then look, is there any member in that generation affected or not. So if we see here, this female is affected in the first generation, then this male is affected in the second generation, this female is affected in the second generation. Come to third generation, you can see this female is affected and these males are affected. So what I want to show you here is that if you make a a table like anyone, you can write anyone affected, and then on the other side you will write generation. Clear? So we just want to see what is happening. So you write first generation, second generation, third generation, and then you would see in first generation tick, second generation tick, third generation tick. So what we are getting here, that in every generation somebody is getting the disease. So this is the classical finding for identifying a given pedigree as autosomal dominant. In every generation, at least somebody will be affected, right? So whether it is male, female, there is no concept of that. It can be transmitted to anyone, and everyone, every generation will show affected offsprings, right? So this is very easy to identify. Just look at the generations, and if you see at least one black box or circle in every generation, straight away make it as autosomal dominant. Clear? Then there are plenty of conditions which are having autosomal dominant inheritance, and now it is up to you how you memorize those conditions, right? Because there is no concept to remember those. So here I have made a mnemonic. I hope you might like it. So hereditary spherocytosis, achondroplasia, von Willebrand disease, adult polycystic kidney disease, neurofibromatosis 1, and then osteogenesis imperfecta and Marfan syndrome. So the list is very long. It's up to you how you can make your own particular mnemonics, right? So this is autosomal dominant. One parent heterozygote is sufficient. Now we move on to autosomal recessive. Now when we say recessive, again we have to talk in terms of heterozygotes or homozygous. So this is hetero, okay? So this is heterozygous, okay? And this is homozygous. Now in autosomal recessive, homozygous is needed to express the disease, right? They will not express. In fact, heterozygotes will continue as carriers. They will carry the abnormal gene, but they will not manifest the disease, right? So heterozygous are simple carriers, they don't manifest. In recessive, both the genes have to be abnormal, have to be mutated, then only the condition will be expressed or will be shown, right? So if I say to express the disease or to show the disease, individual must be homozygous. Clear? And homozygous means both the genes must be mutated. Both the genes must be mutated. And if it is a heterozygous state, one normal, another mutated, they will not express, they will be asymptomatic carriers. Clear? So I am using the word asymptomatic, means will not show symptoms. They will not show any symptoms. Simply they are carrying the abnormal gene. Now, if both the parents are carriers, means both the parents are heterozygotes. If both the parents are carriers or heterozygotes, they will have one normal gene and one abnormal gene, right? So normal and abnormal. Now their offsprings, one will be completely normal because he is having both the normal genes. Then two will be carriers because they have one normal, one abnormal. And only one will have both the abnormal genes, that is, only one will be homozygous here, and this homozygous will manifest the disease, right? Two will be heterozygous and they will become again carriers, and one will be the remaining one will have no abnormal gene, so he'll be normal. Okay, so this is normal. So if the equation is like both the parents are heterozygous, then only they will be able to transmit the disease to offspring. Right? So both the parents need to be heterozygous to transmit the disease, and if both are heterozygous, because this is and this, both the parents are heterozygous, and what we are seeing here, 1 out of 4, that is 25%, will manifest. 1 out of 4, that is 25%, will be normal, and 2 out of 4, that is 50%, will be heterozygous, that is carriers. So 1 affected, this is 25%, because there can be total of 4. So 1 affected, 1 will be normal, so this is 25, and the kid number 3rd or 4th, they will be carriers. So this is 50%. So this is the distribution if the couple are presumed to have 4 children, right? So if both the parents are heterozygous, 25% of possibility of the kid having the disease out of 4, right? So this is very important here. Now there is one word which is always associated with autosomal recessive conditions, and that, if you see here, you can see the double lines. Okay, so you can see the double lines here, and I told you in the beginning, if you see double lines, it means consanguineous marriage, means marriage between relatives. And why we say, because in a family, brother and sister of one particular generation can be heterozygotes. One particular generation can be heterozygotes, and therefore if they marry, then there is possibility that 25% of the children will show the disease, right? So this is very important here, and therefore this concept of consanguineous marriage is always very valuable for autosomal recessive conditions. Clear? And now coming to pedigree, if you see here, first generation, second generation, third generation, fourth generation, see the order. First, this is the birth order: first, second, third, fourth, fifth, like. Now if we mark the members in a generation: normal male, normal female, normal male, normal female, affected female, normal male, normal female. So we see that there is one member which is affected if these two parents, they have married, and this suggests that they were heterozygotes. Then again, normal female, then normal looking male who is not expressing the disease. So when I say the word normal, it means who is not showing the disease. He can be a carrier. So carrier also looks normal, right? So again here, female, male. Now there is a consanguineous marriage between this male and this female. So they are from the same family, but they have married with each other, and therefore what we can see downward in the offspring, we can see affected male. Clear? So they have married in the family only, because this male was from this generation and this female was from the second generation, right? But with different parents. Clear? So if you see it in a nice way, this female was from this family, this male is from another family. Clear? So this is from another family. This male is from this family and this female is from another family. So this male and this female, they were actually brother sisters, right? So when they have children, these this male and this female, they were having they are married in relatives only. So that's what's the what is the concept of consanguineous marriage, and that what predisposes for autosomal recessive disorders. Clear? And one of the important condition in clinical practice is thalassemia. So we always check, like always screen like for this heterozygosity if we suspect a consanguineous marriage. So that's very important. Clear? And there are plenty of conditions again in this list, and if you tend to forget, at least you can remember one thing: many inborn errors of metabolism which you might have studied in biochemistry, they all fall under autosomal recessive, right? So phenylketonuria, alkaptonuria, everything will come here. So if you forget, at least remember this, that all inborn errors of metabolism are autosomal recessive. Apart from this, few vascular entities like sickle cell, thalassemia, Wilson disease, hemochromatosis, then these are four hematological conditions which are having autosomal recessive inheritance. Then cystic fibrosis, then these are all enzyme deficiencies, alpha 1 antitrypsin deficiency, phenylketonuria, alkaptonuria, right? So this is autosomal recessive. Now again, this is actually the way of representing the carrier. So this is a male here, this is a female, both are heterozygotes. Okay, so these are heterozygotes, or what we say carriers, and we discussed that there is possibility of getting affected offspring if both the parents are carriers. So you can see there is affected male, there is affected female. Okay, so this is how you can see the pedigree of autosomal recessive. Always look for this double line. If you find a double line in a pedigree, straight away jump to autosomal recessive, because there is no other inheritance where we discuss consanguineous marriage. It is only discussed in autosomal recessive, right? And another thing what you can see here, if again we make a table like anyone affected, and then you will write generations here. Clear? And then you will write generation 1, generation 2, generation 3, generation 4 as per this pedigree. So you will see that no one is expressing the disease in first, one is expressing the disease in second, no one in third, and one in fourth. So you can see that not every generation is affected here, right? So this is one thing. So it tends to skip generations. So very easy to identify a pedigree of autosomal recessive. Then we move forward to X-linked recessive. Now the term is X-linked, so it is related to X chromosome, right? And the word recessive again means there has to be a homozygous state for expressing the disease. Homozygous means both the genes have to be mutated. But here you should remember one more thing, that if you see a homozygous state for X chromosome, like this one is mutated, this one is normal, so this is heterozygous state. But if you see in a boy, and if this is mutated, now the Y does not counteract this mutated gene, and therefore it will show the disease, it will express. Clear? Because Y has no power to counteract, and here this is normal, So this normal can contract and therefore it will not manifest or it will not express. So this is an additional fact in X-linked inheritance, and we have to consider Y as well, because Y does not help us in masking the disease, you can say. So now here the condition is transmitted by carrier woman, right? So this is actually a carrier, because this is heterozygote, right? So this is heterozygote and she is a carrier, and for to avoid confusion I should remove the word normal here, because that was for normal gene, right? So heterozygous, one gene normal and other gene is abnormal or mutated. Clear? So here I have used this orange color to represent the mutated gene. So suppose if the lady is a carrier, means if the lady is heterozygote, you can see this one is normal and this one is mutated. Clear? So I'll write N and M as the short forms. So now in male this X is normal and Y has no importance in X-linked disorders. So now what will happen? Again we can see here this is mutated, this is normal, this is normal. So what will happen? There can be both normal, both X normal. There can be normal, and for Y I can use this yellow color. So this can be the possibility. Then there is other possibility that this mutated gene may be gone, maybe go to the kids. So this mutated here, this mutated here, and then this normal from the male and this Y from the male. Okay, so now what we are seeing here, this is normal, this is normal. Clear? Now in female this is carrier, because one is abnormal, right? So this is mutated, this is normal, so this is carrier. But as I told you, in males, even if X is affected, normal Y does not make any sense. So this becomes a patient. So you can say he will express the disease. Clear? So what is written here, the condition is transmitted by carrier woman and the condition will go to the male child, because Y has no power to counteract the mutated gene, right? So this is the outcome if father is normal and mother is carrier, right? This is one thing. So here the boy will be affected. Now let us take the reverse thing here. Okay, and so one thing which you can notice here is that boys are usually affected. Clear? So one thing which you can take note down from here, that boys are usually affected in X-linked recessive disorders. Okay, that's very important. Now let us take another scenario when the mother is normal. Just reverse the things, and the father is carrier. And I think everyone must be understanding the word carrier by now. Carrier means heterozygotes. So here this is mutated and this is normal. In mother both are normal. Okay, so normal, this I can draw it Y by yellow color because it is immaterial. So this is mutated. Now let us take the outcomes. So this mutated can go to one of the daughter, and the other one will, of course, the other x will of course come from mother, right? So say this x is coming here and this x is coming here. So what is happening here? The female child, because XX is female, so she is a carrier because she is having one mutated, another normal. And look at the boy, because X is coming from mother, okay? So X will come from mother, and father contributes only Y to his sons. So this Y is coming from the father. So it means the son is normal. So what I mean to say, if the father is affected in X-linked disorders, he is contributing only X chromosomes to the offsprings, and X chromosomes offered by the parent, the father, will always result in daughters. So the condition, the affected gene will always passed on to the daughters. It will never pass on to the son, because in son the male father is contributing only Y chromosome, which is immaterial in X-linked disorders. So what does this mean? Father will not pass the disease to son, right? Clear? Because only Y will go here. X is coming from mother. So in X-linked disorders, everything related to then mother only, right? So father has no authority to pass the conditions to his son. So what we say here, there is no male to male transmission. Means this is father and this is son. So the condition cannot go from father to son. This is one thing, right? So if I say here, affected males have normal sons and daughters will become carrier, right? So daughter is carrier here, and affected males means, again, this is heterozygotes, clear? Or homozygotes, whatever you say, right? So it can be anything. So this is important here. If the father is affected, and if the mother is normal, the girls will be carrier and boys will be normal, right? So this is a very beautiful concept. For X-linked disorders, there is no father to son transmission. Now coming to diseases, Duchenne muscular dystrophy, if you have seen a typical Gower sign, it's always said that the boy tries to climb on himself. Color blindness only seen in boys, hemophilia only seen in boys, G6PD deficiency only seen in boys. So boys usually manifest the disease in X-linked recessive transmission. Clear? Very important. So for XLR, again you can see, if we write anyone affected, right? So if I write anyone affected, and then you will see generations, clear? So write generation here. So generation 1, 2, 3, 4. So what you will see, affected, no one affected, affected, no one affected. So again you can interpret that the trait, it is skipping generations, right? One generation is affected, another is normal, then affected, then normal. So it is not in every generation as we see in autosomal dominant. And the only classical clue word is that father do not pass the trait to their sons, right? So if you see in any of the now this is affected father. So you will see none of the son is having the disease. So it means the father is not passing the disease to son, right? So in any way, the father will not transmit the disease to son. Only he can transmit the disease to a female child who will become carriers if mother is normal, right? And very importantly, males are more affected than females. So usually we see male patients in X-linked recessive inheritance. Clear? Now the next one is X-linked dominant. So again, when we say dominant, the only thing is that homozygous or heterozygous both will manifest the disease, right? So both will express, whereas in recessive only homozygous will express, heterozygous will become carrier, right? So here, and if one of the genes is abnormal or mutated, patient will manifest the disease. So suppose if we take one chart here, heterozygous female. Now this is a heterozygous female, this is mutated, and this is normal. In males, this is normal, Y is of no consideration. So this is normal, and this is abnormal. Now when this will happen, this X, this mutated X can go to one of the son and it can go to one of the daughter, right? So this mutated X is coming here, and then this normal X will again go to two of the children's. So this is, you can say like this, and then Y will come from father, and this Y is also from father. Okay, so this is the usual scenario. Now what we are seeing here, the affected, now in case of males, single affected X is sufficient to express. Clear? So the boy will express, and then the other boy is normal. So it means 50%. Out of two boys, one is normal, one is expressing the disease, right? And similarly, if we look for females, this is a heterozygous, but still she will express because this is a dominant condition, and this is normal. Both normal. One from mother, one from father. Clear? So 50% of the daughters are also expressing the disease. So if a mother is heterozygous and of course normal father, the disease will go to 50% of male child. It means one will be affected, another will be normal, and 50% of daughter means one daughter will be normal, one will be normal, and another will be affected. So this is X-linked dominant. Now, needless to say, if the lady is homozygous, so what does this mean? Suppose if in homozygous both the X chromosomes are abnormal. Male is normal here. Okay, so I'll write it with some other color. So we can take it like this. Now what will happen? Just have the, okay, so it can be something like this, right? So here X will come like this, and we can draw it with some other color also, so that will help us understand nicely. Okay, so this x is coming not here, x will come before y. So this is here, this is here. Clear? So these x hairs and these x hairs, then male x here, and then male y here. Clear? Now this is the normal father and homozygous mother. Clear? So now what is happening, you can see here, this is heterozygous, this is heterozygous, and again for male, heterozygous homozygous doesn't matter at all, right? So these are all express, right? These will express, so all sons will express, and also all the daughters will express, right? So these are daughters and these are sons. So it means if a lady is homozygous, all their sons and all their daughters will express the disease because it is a dominant entity, right? So it is a dominant entity. So even if one of the gene is abnormal, it is sufficient to express the disease. So all the kids are showing the disease, right? And if we reverse it, like if we take it in other way, like the affected father, so this is the affected father and this is x linked, so only x will be mutated, y has nothing to do, right? So if we do it like this, these are both normal here, so in the mother is normal, so affected males. Now we look here, this x goes to daughter, because for son the male, the father will contribute only Y chromosome. So this X can come here, this X can come here. So what we are seeing here, the son is normal, right? But we can see that the daughter is heterozygous. Okay, so this is heterozygous, but since we are discussing dominant, so she will express the disease. Clear? So she will express the disease. So affected males pass the trait to none of their sons, right? This is normal, but all their daughters, right? So this is how you should understand the X-linked recessive and X-linked dominant. It might look little difficult, but it is extremely easy. All you need to understand what is homozygous, what is heterozygous, what is X-linked, what is autosomal disorders. X-linked will be always talked in terms of X and Y, whereas autosomals have nothing to do with sex chromosomes, right? So the example here includes hypophosphatemic type of vitamin D resistant rickets. So okay, so again if we draw the pedigree, the mother is affected, and then again it depends on whether she is heterozygous or homozygous. Clear? So this is autosomal X-linked dominant. So it needs a little bit application of knowledge, and I think these are scoring questions. You can never be wrong in this. And the only thing which you need to remember here is that there is no father to son transmission. The only keyword for X-linked disorder, right? So there is nothing like father to son in X-linked disorders. It can be recessive or it can be dominant. Fine. Again, if you see here, this is affected father, but the disease is going only to daughters, and you see the male child are normal. Clear? So that is very important to uh, see particularly. And if you see that if the father is affected, if the male father is affected and the condition is only going to females, then this suggests that yes, we are talking something about X-linked inheritance. Then one of the more easiest type of inheritance is mitochondrial inheritance. So again, if you see here, this is male, this is female. Okay, so male and female. And if you see, this is the first male child of family, then this is the female child in the family out of this couple, then this is the male child, this is the female child, this is the male child. Now these are the original childs of this couple, and then they are married to some other people from some other family. Okay, so like this. But what is important to note here is that the female was affected, and as a result of this, all the childrens of this couple are affected. So what I mean to say, if the mother is affected, she will transmit the disease to all the childrens, and it doesn't make any difference whether father is normal or affected. This is only through mother. So if mother is affected, all the children are going to affected. So if in the pedigree, if you see mother is affected and all the children are affected, straight away jump to the answer as mitochondrial inheritance. So if you see in third generation, now here this mother is affected. So out of this couple, you will see that this female child is affected, this male child is affected, this male child is affected. So all the three are affected here. So all the three which are from this couple, they are affected. And on the other side, if you see, this male is affected, this female is normal, so none of the child is affected. So all normal. So it means male is not able to transmit the disease, only the female are able to transmit, and all the childrens will get the disease. So this is mitochondrial inheritance. Again, if you see here, this female is affected, this male is affected, this male is affected, this female is affected. So out of this couple where the female was affected, all the childrens are affected. So this is the mitochondrial inheritance. If male is affected, no child is affected. Male is affected, no child is affected. Mother affected, all children are affected. So this is mitochondrial inheritance, right? So this was all about single gene disorders, and I have tried to simplify the concept, but I am very sure if you revise it again and again, you will be very perfect with that, and there is no point in making any error in this segment. So I am very sure you might have liked the session. Stay tuned for more. Thank you. God bless.